and she wants several things which is perfectly able to combine in one, like 1.5-hour treatment. She will have an IV cocktail with the vitamins. I'm mixing that special for her. That is the whole purpose of customized IV vitamins. It's not coming mixed for everybody. It just would be special for our beautiful Doris. And then we will draw the blood and do the PRP procedure for her face rejuvenation. And in addition, Doris has a little problem over here. She has very little and very old scar, which she doesn't like. So we will try to help her to get rid of that scar or decrease its appearance. And Doris have naturally large pores. That's another thing what she cannot do much about that she been born with that type of a skin, but that pore appearance can still be reduced by using PRP and a microneedling. So we'll do the PRP procedure and the microneedling after the PRP injections are in place. Our third stage preparation is the IV preparation for Doris. We'll use trace elements. We will use potassium, we will use calcium, we will use some magnesia, some vitamin C, okay, vitamin B complex, vitamin B12 as methylcobalamin, and little polyvitamins. What that cocktail will do for Doris, it will do several possible stuff. It will help you to achieve better energy levels. It will help your cellular cell. It will help your metabolic rate. It will support your immune system. It will help you to restore the skin. But one particular reason why we're doing that for Doris today is because we're doing PRP procedure, what expected to have a lot of regeneration processes stimulated in your body, and as we know, with any regenerative processes, the body needs all the resources. So that is a perfect combination to do the IV with all those vitamins at the time of the PRP procedure. It helps each other. So this is our cocktail. Nice and pinkish, look very sunny, look very summer. Ready for the patient. Okay. with little numbing because this procedure is not unfortunately painless, so we want the numbing. And the cream I usually try to keep for about 15-20 minutes because before that the cream is not done in a full action. Yeah. We are ready for Doris' procedure, and the main dessert for her today is a PRP, right? So that equipment we use for her, we use the Eclipse. PRP need to be done with a special equipment. It is not all the same. There is several companies in the country which is FDA approved, and that is equipment which should be used for the PRP procedure. One of those companies, if I believe is longest on the market, is a PRP Eclipse, and that's what we use in our office. Only good FDA approved supply and equipment. Alright, so we will do our IV start. And because that combined procedure, both IV and the PRP procedure need a venous sense, I will try to do it in one shot. I don't want to do the, okay, just like this, good. I don't want to stick Doris several times. It may take me a little bit more medicine than average because I don't want to stick you for several times, but it's still worth it, you know, the less stress for the patient vein, the better it is. Okay, so we're in the vein and we draw our blood. A little bit more. To connect here to the IV through the same established line, which is we already have. Were you in pain so far?
No.
Good. And now our IV is running and Doris have her vitamins going into her body. Our next steps is to start processing the PRP. And this is a special centrifuge for that PRP. Says Eclipse as much, right? Everything should be right equipment, right company, everything should be right. And we're starting spinning the PRP. It will take approximately 10 minutes. Now, I asked Doris if she is tolerable to the pain, and she said not always. As you saw, we did put a topical cream for her, but I asked if she wants to have some painkiller. And she said, yes, so I'm gonna give you a little Toradol, that is a painkiller, which will help you to feel a little better through this procedure. So by the time we'll go to microneedling, and microneedling will probably be the most discomfortable part of what we do, she should be a little bit better with the pain sensitivity. Doris gave me a good question. She asked me how frequent should she do those infusions and what will happen if she cannot stick to a schedule. Those infusions are elective, right? My recommended regimen, the first month when she is loading, I recommended to do it once a week. After that, for the most of the people, once a month is sufficient. And what those infusions do, why are we different from oral supplements? Because most of the component which is in this bag, you can do orally, right? So what is the difference? The difference is it's bypassing GI tract, right? It goes straight to the vein. Because it goes straight to the vein, you are not losing the vitamins or minerals, whatever is in the bag, due to the GI absorption. That is our limitation, how much we can absorb. You can take a lot, you can get a little because you're not absorbing it. Those vitamins in the bag and minerals, they are water soluble, they are not fat soluble. What just means the body cannot store them, ever. We get in them with dietary intake and we take it's been taken out with the natural function of our body. But if we're not having enough of some vitamins or the substances, it may not be deficiency, it's more commonly be insufficiency, which means we have some, but it's not enough for everything. If it's not enough for everything, your body will use the vitamins for the most critical function. Like vitamin B12 will be used for blood creation, right? And some less important function, not less important, but less critical function of the body, which is still need the vitamin B, will have whatever is left over. By giving that fluids bag of vitamins, we over-provided. We're creating the situation when the body can grasp as much as it's needed because it's available, it's over-available. So the function will be restored. The body will start repair with function. The body will just start normally, work normally. Vitamins, excessive vitamins, which is in the bag, will be eliminated, mostly through the urine. Like for the next couple of days, as I said before, all your body fluids will smell vitamins. That is perfectly normal.
Okay.
All right. And that is what the vitamin do. We kind of maintain function by providing nutrition and providing in that bag is some rare elements in amount what will allow your body to restore itself. Okay, so I hear my centrifugal head plate, and now our PRP products should be ready. Okay, and it is. We're going to transfer that product into smaller syringes. What will go to the patient body. How's your face feeling, huh?
Especially here, around my lips.
Okay. I'm going to remove the cream, right? We don't need it anymore. And remove all your makeup now on this cream. And now I know you do have makeup.
You didn't know? Just a little bit of concealer.
Okay. And we will do a little skin cleaning with alcohol. Okay. So let's start from here. There is a little bumps which is up, you can see right now. Those bumps is not gonna stay. They will be resolved in the body in the next couple hours, and Doris will be okay. All right. Same thing over here. And one which is I treating her under eyes is because Doris has a little tendency to have a dark circles. And I hope to decrease this dark circles tendency with my PRP treatments for Doris. Now, this is area of our problem, which is a scar. So I'm gonna inject PRP right under the scar, all right? Because this is our special zone which is need extras. Okay. And I'm gonna inject here a little bit to do the eyebrow lift. Is it really painful, Doris?
It is painful.
It is? A lot?
No, not a lot.
Not a lot, right? Actually, I want to do something different for her nasolabial. For her nasolabial and for this corner, I want the extra support. So to give her extra support, I will do a little alteration of the PRP, and I will get the product what will stay longer in this designated area. It is not as long as the fillers, absolutely not. It will not lift up as the fillers, but that PRP product will stay slightly longer. She may have it in the area up to 1 week. That will stimulate more collagen production to these zones, and she will have better effect to this PRP. So we do this. Another video. Okay. And we do the same for this side. Okay, now I'm gonna do slight injections over her forehead and just support her skin in here. Okay, so this is our first syringe. That slight swelling under the eye, it's not really swelling, it is a fluids, because you remember I injected fluids, and it will be absorbed back to the body. It's not gonna stay there for long. It's a couple hours and it will be gone. Now I'm gonna treat your pores, right? Because this is another thing which is we kind of don't like about this. And the question is where PRP can be injected. PRP can be injected everywhere, right? Because it's a very natural thing. It is your own body product. It's not gonna harm. It's not gonna give you allergic reaction. It's not gonna give you any adverse reaction. So we use all our PRP products, and that is a part about the PRP injections, right? We're done with the PRP injections. We still have microneedling go. You're still alive?
Yes.
Okay. Cut. And now we're preparing for the next step procedure, which is a microneedling, and there is three types of the microneedling which is exist and known, right? One, microneedling is what you may do yourself in the home. It is very superficial. It doesn't do any bleeding. That states it's helped to improve absorption of some cosmetic products, and this is what you usually achieve with the dermal at home and things like this. The second stage is a medical microneedling. This is a procedure which is need to be done by a professional in a clean environment, which we have here is a clean environment. And that procedure undermines some capillary bleeding. That is something to help with the two possible ways to help. One is that we do create capillary bleeding, so the blood coming out, and we do have some platelets coming out with the blood. Then we destroy it, we release the growth factor, and then you do the just microneedling procedure, that is your driver for the therapeutic effect. But when I do that procedure, microneedling procedure, with combination of the PRP, because the PRP is so much stronger, those injections in her skin is already giving her that extra growing factors which she needs for a reconstruction of her skin. My goal is different. My goal is to destroy the thick tissue in her skin, what she accumulates for her lifespan. And that could be the previous sunburns, that could be the acne scars, visible and invisible, and of course the visible scar, what we were concerned from the very beginning, right? So all of those tissue, they not allow grow the new tissue through them. So usually when you have it without, you know, some stimulation, the tissue will grow around, right? You will still have a new skin, but it will be around your scar. What the microneedling does, we creating the pathway for the new skin to surface at that really position where we need it to surface. And that's the main thing why I combine in PRP and the microneedling in one procedure, and why I love this combination. So for that procedure, we'll use a dermal pen. And we have sterile needle, it's disposable needle. We're using that once a lifetime. We're not saving those needles, okay? So that will be a needle for this procedure. Okay. And we do use some light. I like ultraviolet light because besides of other things, it's an antibacterial and we can use it. And what the dermal pen do when we turn it on, it goes like this, right? And this is a dry shot. I'm not injecting anything with a dermal pen, obviously. But this is our instrument for that procedure. And for Dolores, I will use the Aerolase, their apple stem cells serum. That is a serum specifically made for being used with a micro needling procedure. And why I like this one is because it's giving a little bit more stimulation. Today is all about stimulation and the skin growing, so that's why I'm using that choice of a serum to put your stimulation to the highest possible level. So we'll start very superficially. We'll go with 0.5 millimeters of penetration. Okay. First coat will be dry coat. And we use more like a stamp-like technique. Because if you do use different technique, you're more likely, I know this is vital. And here I will go to the areas which is previously were not treated, because we want your skin nice and we want your skin tight, right? Okay, so that is our first skin, and we start working on the scars. Okay, so this scar is my primary area, and I will be touching that again and again. And she doesn't like it, I know what she will not, but that's what will give her. Okay, so right now we are very superficial. You practically see no blood on that face, right? That means we did not get to the air, to the deepness, what we will get the therapeutic effect of a medical microneedling. We're applying some serum, and you may have some sensation, should not be pain, but a little burning. Pretty much anything I touch right now will be burning you. Okay, even water will be burning a little bit, because you know, we have a little trauma to your skin. Control trauma is a therapeutic mechanism overusing. Okay. And I go slightly more with the deepness, like maybe like this more with the deepness. Skin on the forehead, unfortunately, the most sensitive. It's the highest to travel to tolerate it. See, we start getting that capillary response. Okay, and this is what we need to see. So hopefully we will need to go any deeper for those. Getting rested a little bit? Yeah, you alright?
Yes.
Okay, you wanna curse me? Okay, alright, try to relax, okay? I will try to be as gentle as possible in that situation, okay? Okay, so we start getting the capillary response. See, a little dot of the blood. Okay, and we're doing the source code. Drop. Oh, okay. Take a deep breath. All right? Okay. And that is my last chance, because it's a last chord. It's my last chance to get the most of the effect. Okay, so the torture is really done. Okay?
Done.
It's done. Okay, no more needles. But we have a couple more steps of procedure, but they will be a total pleasurable. So now what we'll do, we will put 10 minutes normal saline mask on Doris. And this is just normal saline, okay? And we're using Touch tablet mask.
And that is for?
Just to absorb all those good things which is on your face right now.
Okay.
So we have this mask. And we apply this mask. And
Feels good.
yeah, and you will be resting with it for 10 minutes. Okay, so 10 minutes is passed and we have mask removed, right? And you remember what was her face before we put the mask on, right? Look at this now. Little pinkish, but not much signs of the procedures at all, right? Okay. So we have a very last stage of what we're gonna do today, and that stage is total pleasurable. We're gonna do a little ultrasound clamp with a mechanical massage and a little light, and we need it because now when she has a PRP inside of her skin, I want her platelets to be breaking down. It's called platelets activation, and I want her to be disturbed as possible, like the PRP product disturbed as even as possible. So that last stage of procedure is a polishing, finishing, activating platelets, and in general all my patient love this part. So I'll put a little bit more serum, and then this time it is a hyaluronic acid because we basically need a little lubrication for that part of the procedure. And just remember, all back parts are over. So we do sonic lamp, we do vibration, we do ions, and we do the photon. Anything you put on your face right at this moment will tendency to burn. Even like a clear water will tend to burn you because of the microneedling, because of advanced controlled superficial trauma. Okay. This part is pleasurable, right? I know everybody like it. And for some reason it is even the pain relieving part. Usually after, like, whatever pain was left over through this procedure, usually after that lamp, the people say we don't have any pain anymore. That's it. Right, so that is a little thing. It's like when we do the shots, I do expect a couple areas, like particularly over here and over here, we may have a little bruising, alright? So I try to minimize that bruising and maximize the time of that bruising will disappear. I cannot say it will not be there completely, but we use an Aerolase for the bruising thing to